Hi, this is Ashley.
Hi.
And this is Carissa. And this is our video on home care aids. Today we're going to show you the proper way to brush and floss and to use other different types of home care aids. So today we're going to first start with Carissa brushing her teeth. Carissa, can you please show us the right way to brush your teeth?
Sure.
Okay, whoa. Carissa, I don't think that's the right way. Let's teach you a new way. First, you're going to put your brush at a little bit of an angle on your teeth so it goes into your gums, and then you're going to brush in slow circular motions.
Is this slow enough for you?
Yeah. And then you're going to sweep all the stuff off your teeth down. Perfect. That's known as the modified bath technique. Okay, Carissa, let's say you have recession.
I think I've heard about this kind of brushing. It's called the Stillman's, right?
Correct. So you're going to do just like the modified bath, you're going to do small circular motions but not against your gums. So move the toothbrush down a little more. Perfect. Small circular motions once again and sweep down. Awesome.
Another method of toothbrushing we can use is called the Charters. It's used for people with braces who we might see pretty often in our offices. What you do is angle the toothbrush down towards the bracket and do your little motion, your little vibrations. That way it's getting all in there. What do I do now? Then you flip. Get all around that little bracket. Got to get all that across.
So for children, there's another method called the phones. This helps them learn how to do the circular motion. And what they do is they use the toothbrush on both arches and go in big circles. Very good, Carissa. So the next step after brushing is flossing. Find your floss, Carissa.
Got it.
Okay. So you want to grab a length of about an arm's length long. Perfect. I see. And then you're going to take the floss and wrap it around your two middle fingers.
Oh. Now what?
Now you're going to go in between your teeth making a C motion. Well, not quite. You got to use your index and your thumb finger to help guide the floss in between your teeth. Be careful not to snap it in. Slowly move it in, and then you're going to make a C on one tooth and then a C on the opposite tooth. Perfect. And you're going to do that throughout your whole mouth. That's good, Carissa. Good job.
You know, Ashley, I'm getting really sick of just, and the fingers, my circulation's getting cut off. It's really hard for me to reach back in my mouth because it's so tiny.
Well, there's other types of aids that can help you with flossing.
There are?
Yes. For example, the Flossmate. Let's see if you could find that.
Got it.
Perfect, Carissa. Good job putting that together.
Thanks.
So instead of flossing, you can use that, and that also just goes in between your teeth, and you help guide it in and move on one side of the tooth and then the opposite side of the tooth. Perfect. Another aid that you can use are called interdental brushes. Perfect. That's the holder. And then there's little brushes that put inside just like that. Perfect. Now these are used with people that have a little bit more spacing, unlike Carissa, who has pretty tight contacts. So this is also good for
tight contacts.
for people with braces, helping to get in between the wires and the brackets. Where's our little guy?
What guy? Are you done for?
Yeah. With the braces.
He doesn't have contact. Well,
Okay. You get right in between the wires, and you can get along the brackets. Perfect. Okay, so to go along with all these aids that are used for interproximal spaces, there's also something called StimuDents. StimuDents are like toothpicks, however they're made out of balsa wood, which is softer. And this is also used for people with more open contacts and with blunted papilla. So to use these, the flat side goes towards the gingiva, and you can kind of just go right in between the spaces.
Oh, it hurts so bad.
Well, don't go in there. You don't have blunted papilla or open spaces, Carissa. Good job. So now, for those hard-to-reach areas, Carissa, we use something called an N-Tuff brush.
Got mine.
Perfect. Also good for people with braces to help get in between the brackets and the wires. Gotta go on the black. Okay. So this is used more for the posterior regions and hard-to-reach areas. Look at that uvula. Good job.
Oh, it really gets the best.
To help the natural process of cleansing, you can also give your patients or clients a stimulator brush. This helps stimulate the gingiva for the natural cleansing process. So this tip could either go interproximally, or it can go around the gingiva and the tooth.
Like what?
Yeah. Move your lip away. Up and around. Good.
Another really important thing to remember is all the different kinds of toothpaste you can choose from. You can have lots, like this one, which is mainly just for bad breath. You can have...
Put another one in there.
This one, which is pro-health. Look at all the benefits it has. There's a lot of other different kinds. Like you can get just whitening toothpaste. That works really good sometimes. But if you have composites, that's a no-no.
Sensitivity.
And they have different kinds for sensitivity. Like Sensodyne Pro.
Mammal.
Pro Nano Sensodyne. This is for really good with people who are really sensitive to hot and cold stuff.
Okay.
Different kinds of mouthwashes are available too. This one's for stinky breath. This one's a lot, and it's good for the night. Multi-protection. There's other kinds you can get that have fluoride in them and whitening. But they also have fluoride rinses too. Those are really good to protect against cavities.
Okay, Carissa. Let's see how good you brushed and flossed your teeth today.
Time to disclose?
Time to disclose.
My favorite part of the day. Breaking you off a piece of this tablet.
Good.
Look, no red.
Good job, Carissa.